According to the World Health Organization, recent communicable diseases found among native Syrians and Syrian refugees include tuberculosis, malaria, cutaneous leishmaniasis, and polio. Prior to wars, infectious disease rates were decreasing. Due to ongoing warfare, poor sanitation and lack of proper shelter are present. Similarly, measles and polio have reemerged due to warfare, along with Syria's poor economic progression and accessibility and quality to healthcare. Immunization efforts for measles have been made, but in some cases, vaccines aren't as effective. As for example, some polio vaccines administered in Syria have resulted in deaths. These vaccines are also administered inconsistently, as those who are closer to larger cities have more access to vaccinations than those in rural areas. The graph on the right compares communicable diseases between Syria and Eritrea, another war-ridden but smaller country. This graph confirms findings as greater prevalence of diseases found in Syria were leishmaniasis, Sabin-like polio, and tuberculosis. Despite the fact that both countries are war-ridden, Syria has higher communicable disease rates when compared to Eritrea due to the higher population of people affected. The Ministry of Health is working to improve the monitoring of these diseases to reduce rates of communicable diseases in Syria. Some progress has been made, particularly in disease surveillance of Syrian refugees. Again, because of ongoing conflict, progress in disease surveillance of native Syrians is difficult. There are a lack of laboratories and tools needed for diagnostic testing of diseases such as tuberculosis, hepatitis, polio, and measles. There is a lack of medical professionals, as many have been killed from these wars and don't want to practice in Syria because of safety concerns. With increased disease surveillance, increased rates of infectious diseases are being seen in neighboring countries such as Jordan, Turkey, Lebanon, Iraq, and Egypt. One issue with this is that Syrian immigrants are unable to afford health care in these countries due to the high costs of paying out of pocket rather than being covered by insurance. Another issue is the disease burden shifts from Syria to neighboring countries. Lebanon and Jordan have reported increased tuberculosis rates among its Syrian refugees. Similarly, cutaneous leishmaniasis outbreaks were found in Turkey, Jordan, and Lebanon. The top right picture shows a young boy receiving an MMR vaccine from a UNICEF-sponsored 10-day measles immunization program in an effort to reach children in more remote areas. The program reached 840,000 children out of an estimated 3.2 million. The bottom right picture shows a child with cutaneous leishmaniasis, a parasitic disease caused by sandflies. This form affects the outer layer of the skin and is treatable. However, if it's not treated within a year, it can spread and become a more fatal form, visceral leishmaniasis, which infects several internal organs.
Non-communicable diseases are also prevalent among the Syrian population. One of the major issues facing Syrians is mental health issues, especially those associated with trauma. The trauma has an effect on all Syrians, but a lot of research has been done on children in particular. One study found that of 492 school-aged children surveyed, 60.5% showed signs of a psychiatric condition, the most common of which being post-traumatic stress disorder, or PTSD. Traumatic injuries are also common in Syrians coming out of areas of conflict. 5.7% of refugees surveyed as they leave the country have war-related injuries. The most common of these injuries are burns and gunshot and shrapnel wounds. This shows that war has had a major effect on the health of Syrian people. A non-war related NCD is a genetic disease known as familial Mediterranean fever. It is also commonly passed from one generation to another in Syrian families. Of healthy individuals studied in the Syrian population, 17.5% of them were carriers for the disease. The 5 more common NCDs, hypertension, cardiovascular disease, diabetes, chronic respiratory disease, and arthritis, are laid out in the chart to the left. The prevalence of these diseases increase with age, and hypertension is the most common. A lot of the statistics representing these diseases came from data collected before the war, as it became difficult to collect accurate data once the war began. Before the war, public health indicators were increasing, but health systems studying these have largely collapsed since the beginning of the war in 2011. One such indicator that was studied pre-war was tobacco use. It was very common in Syria, especially among men. 60% of men and 17% of women smoke cigarettes. Also, 20% of men and 5% of women smoke tobacco with water pipes or hookahs. This usage commonly starts during adolescence, meaning 13 to 15 years old, for boys especially. This explains why the most common cancer in Syria for men is lung cancer. Breast cancer is the most common for women. However, these rates are only estimated based on surrounding countries, again due to the difficulty in collecting public health data. Mortality rates of NCDs are also very hard to get an accurate number on due to the war. However, 14.7% of refugees coming out of Syria reported multiple NCD deaths of those they knew.
Maternal health is of great concern in Syria, mostly to blame from war conflict. In Syria, there is an increase in maternal trauma since war has begun. This includes mental illness, infectious disease, trauma, and poor nutrition, which all play a role in maternal health and can also be passed down from generation to generation. A program has been implemented that provides services for children and mothers for their reproductive health. There's also a reduction in breastfeeding in mothers. This causes a lot of malnutrition in the children that are needing the breast milk. As a result of the war, there is also a large amount of preterm births at 24%, fetal growth restriction, and maternal infection. Psychological disorders are another issue that is occurring in children, where 76% of children surveyed have PTSD and also struggle with anxiety, which is almost directly related to the war conflict. Poor nutrition is one of the big confounding factors in children's health, as 200,000 children were estimated to be undernourished in micro and macronutrients. A large amount of children are unable to be reached at almost 1 million children, and so that results in lack of data and knowledge and also unknown health issues. The issues with nutrition are largely magnified in children, as the majority of the population is younger, and this is when development is occurring, so data from children is probably being recorded more than adults, due to the idea that children getting proper nutrition is more important than adults doing so. There's a multitude of issues with malnutrition, including anemia, which comes from a lack of iron in the diet, and also impaired levels of immunity. It was recorded that 11.9% of children under 5 years old were acutely malnourished and is at 7.8% in the childbearing age of women. Food insecurity, which is the inability to meet basic food needs in order to live a healthy daily life, is a predominant issue, and this will only increase as the cost of war is implemented into these areas of Syria. The UN actually estimated that 7 million people in Syria are food insecure and 2 million are at risk of being food insecure. Programs, of course, have been put in place for malnutrition, as you can imagine, but only can solve a number of cases and can't help these unreachable areas where cases may be the most severe. And overall, there's just a lack of resources and an inability to collect a lot of valuable data.
As for the environment of Syria, the nation is composed of 3 different climates. The majority of the country is described as a desert environment and makes up the southeastern part of the country. The remainder of the country is characterized by the semi-arid climate or the Mediterranean environment that stretches the eastern border of the countries towards Lebanon and includes the capital city of Damascus. Most of the remaining population still resides in this part of Syria due to the agricultural advantages and economic resources brought by the Mediterranean Sea. Now let's talk a little bit about shelter. Unfortunately, due to the war-stricken country, there has been a mass destruction of majority of the homes, requiring many of the Syrian residents to resort to refugee camps located near the borders or in the neighboring countries. Syria is also facing some major environmental issues. One of the biggest issues is the water pollution problem. Once again, due to the large amounts of conflict and terror in the country, the problem of pollution has been put on the back burner and has increased drastically. However, a large contributor to this problem isn't just from the country of Syria. In fact, other countries have seen the war in Syria as an opportunity to use the coast as a dumping site. This has come mostly from offshore oiling companies dumping into the Mediterranean Sea. The country also is enduring deforestation and drought with the rising climate change. Sanitation has been impacted by the war as well. As we know, Syria has presented itself as one of the poorest countries in the world and continues with the trend of poor sanitation because of that. Also, the lack of clean water has required Syrians to more efficiently use the water they are supplied with. In fact, on average, Syrians only have access to 6 gallons of water a day as opposed to 19 gallons in 2016. Lastly, Syria's sanitation has been impacted by the overcrowding of Syrian refugee camps that home thousands of refugees in small communities.